So hello, I'm Louise Dark, Chief Pharmacist and Clinical Director.
Hello, I'm Annie Anderson. I'm one of the sisters in the critical care unit at the Queen Elizabeth site.
And we're here today to talk to you about the importance of getting the flu vaccine. So Annie, you work in critical care at QE. You must see patients come into critical care with flu. What would you say the impact is on them and their families?
So we've seen more than 15 patients in critical care with the flu over the last 2 years, and that accounted for more than 130 ventilated days, so advanced respiratory support. 3 of those patients died, and that obviously doesn't account for all the patients in the hospital with the flu that didn't come to intensive care. It has a massive impact on the patients and on their families. It's completely disabling for them, and it can be life-changing. As healthcare professionals, I think we've got a duty to protect our patients and ourselves against the flu. It's possible that you might be a carrier of the flu without even realising and pass it on to your vulnerable population of patients.
Yes, absolutely. So the flu vaccine is the best way of protecting yourself against getting the flu. And actually it's best to try and get it as early as we can prior to the start of the flu season. Why do you think, Annie, that people don't get the flu vaccine?
So one of the reasons that I hear quite frequently is people don't want to have the vaccine because they don't want to catch the flu from the vaccine, or that they've had it in the past and it's given them the flu.
So as a pharmacist, I can say that is not true because the vaccine does not contain any live virus.
One of the other reasons people sometimes say to me is that they don't think the vaccine is effective, so it's not worth having it.
Okay, so the flu vaccine is the best defence we can have against flu, and this year Department of Health are giving the quadrivalent vaccine, which means that we're protected against 4 different strains of flu.
And one of the other reasons people sometimes say is having access to the vaccine, so they don't have time to leave their clinical areas to go to occupational health and get their jab, or that the flu vaccinators are not around, so they can't have their vaccine when they want to.
Okay, so that's a good point. So we're trying to target that this year, and we're going to have stalls in the front of Lewisham Hospital and outside the restaurant at QE, so people can get their vaccines there. And also we're training over 100 peer vaccinators, so that means your colleagues can come out and give you the flu vaccine when you're at work. So no matter where you are in the community, in the trust, people can come and give you the vaccine. And they're all going to be wearing bright t-shirts, so we know who they are.
And that will target people as well that are on night shifts and people that work in remote areas.
Yeah, absolutely. And the good news is that because we're protecting ourselves and our patients against the flu, then we're going to give everyone that gets a flu jab a free hot drink beverage that you can use in any of the Trust cafes. So that's good news. Well, let's hope, Annie, that we do really well this year in protecting our patients and their families and ourselves against getting the flu.